Thank you very much to Health Services Research UK for inviting us to talk at the conference, and thank you very much to all of you who've come along today to hear more about our research. We're part of a team at Manchester University who are conducting a large-scale evaluation of the NHS Diabetes Prevention Programme as it's rolled out in England. And this particular talk is about engagement and dropout amongst the first 100,000 people who were referred into the Diabetes Prevention Programme. So Healthier You, which is the Diabetes Prevention Programme that's being rolled out across England by the National Health Service, is a lifestyle behaviour change intervention that's based on international evidence. People who are at risk of diabetes are invited to come along to regular groups where they have sessions that are about healthy eating and lifestyle. They're provided with help about how to lose weight, and physical exercise happens in those sessions. The people who come into the programme are those who are at high risk of type 2 diabetes, who've been referred in from their primary care practice. People are offered at least 16 hours of contact over a period of around about 9 months. It can take longer for people to go around the programme, but the intention it should take about 9 months. And interestingly, for this particular presentation, the programme isn't delivered directly by the NHS, but it's delivered by 4 provider organisations who have bid to be part of this, and then each local area can select one of those four provider organisations to deliver the services in their local area. So we used data that was collected by the Diabetes Prevention Programme service providers. They collected a variety of data on people as they went through the programme, and we used that data to look at participation in the Diabetes Prevention Programme. And also we wanted to see is not just the extent of participation in the programme, but also how that participation varied with patient characteristics and also between providers and different sites. So the data that we used for this analysis was data that was provided by the NHS Diabetes Prevention Programme, and it included all of the referrals that were made to the programme between April 2016 and March 2019. Now, some of those people referred, the ones who were referred in the final 18 months of that period, would have had no chance really to complete the programme, so we excluded those from our analysis. This left us with a cohort of almost 100,000 people who were referred between April 2016 and September 2017, and that's the cohort that we used for any analysis where we were looking at participation in the programme. Of those 100,000, about 55,000 people attended at least once, so they were the attending cohort, and we used those as a cohort whenever we were looking at of those who attended once, how many went on to complete other aspects of the programme. So if we're going to look at participation in the programme, then we need to define what the participation outcomes are, and we defined 3 outcomes. The first of those was uptake, so among those who referred to the programme, how many attended an initial assessment or at least one intervention session. So the initial assessment is where some health measures, baseline health measures were taken, and the programme was explained to people, and then and that was done on an individual level, and then after that people attended regular group sessions. The second participation outcome was retention, and we looked at this among attenders. So people will count as being retained in the programme if they attended at least 60% of intervention sessions. Why 60%? Because NHS England regards 60% as the number of sessions, the kind of required number of sessions that people should attend. And then the last one is a kind of stronger measure than that of completion. So how many people did actually finish the programme? We defined this as those people that attended the final session, or if that wasn't recorded, where there was a final health outcome measured, because that health outcome measure was only recorded at the final session. And in addition to that, we insisted that people were counted as completed if they'd had that 60% attendance, because if people just came to the first and the final session, clearly that isn't completion of the programme. So in terms of the analysis, we used descriptive and exploratory analysis to investigate the extent of participation in the diabetes prevention, so the extent to which people reach those various milestones that I've just mentioned. And then we used logistic regression to look at how that participation varied among different patient subgroups, so patients with different characteristics, but also between the 4 different providers and the multiple different sites around the country. And we used multiple models per outcome in order that they were adjusted appropriately. We used linear spines where we had continuous variables. We used random effects to allow for clustering by site, and we used multiple imputation to account for the missing data. So, on to the results. We found that almost 100,000 people at risk of diabetes were referred during this period, and of those, 56% took up a place on the programme. I should just say that there may have been other people who were told about the Diabetes Prevention Programme in primary care and considered for a referral, and there also may have been other people who were sent a letter suggesting that they might want to go on the programme, but we don't know anything about those. The only people that we know is the people who've turned up with the provider and therefore have come into the data set. So 56% of those people who either contacted the provider themselves or were referred by their primary care practice took up a place, and there may well be other people who were mentioned about the programme but decided not to even contact the provider. Of those people who started on the programme, the median length of attendance was 31% of the course, and of those who took up a place, 34% achieved the amount that the Diabetes Prevention Programme regarded as completion of the course, and 22% completed the full course. Okay, so we've seen that on average across the country, uptake of the Diabetes Prevention Programme was about 56%, but clearly it's very interesting to see what the sources of variation might be in that uptake, and we can examine that on this slide. So amongst providers there was really substantial heterogeneity in uptake, so some providers seem to have had much higher rates of people taking on the programme than others do. And you can see here that compared to one of the providers that was the reference provider, the odds of attendance were much higher in all the other by all the other 3 providers. And similarly, there was a lot of variation between sites. So in different parts of the country, uptake for typical sorts of individuals could range from 32% to 78%. So quite wide range of different levels of uptake there. We also found that uptake increased with age up till 70, so up to the age of 70 uptake seemed to gradually increase every 5 years, but it decreased with older age. Perhaps not surprising that people in the very older age groups were less likely to uptake the programme. And uptake decreased with deprivation, so the most deprived quintile in terms of index of multiple deprivation were less likely to uptake the programme than those who were in the least deprived areas. And gender and weight, which were also measured at this stage, had little association with uptake. Okay, so if we look at retention to 60%, which is what the providers of the service see as being sufficient to count as completion of the service, again we've got substantial heterogeneity amongst providers there. 2 of the providers are having substantially higher uptake rates than the reference provider, and 1 substantially lower. Big variation between sites, not quite such a big variation as there was for uptake, but still a big variation with sites in terms of whether people are retained on the programme. And at this point, because we're looking at retention, we can look at some aspects of the service delivery, and we can see that we got much higher level of retention where people were offered some sort of out of hours provision. So where people were offered any sort of sessions that were before 9 or after 5, the retention was higher there. We saw similar associations with age, deprivation and gender as we saw for uptake, but we had some new variables here that we measured, and retention was lower amongst Asian and black participants than it was to do with white participants. Retention was lower amongst employed people than it was with retired people, so retired people were more likely to retain on the programme, and it was also lower for people with a disability. Interestingly, people's weight or blood glucose weren't associated with retention, which I think is encouraging. It's not the case that those with the higher weights or the worse blood glucose levels aren't attending the programme. It's not something that's relevant here. We also looked at all of this at full completion of the programme, and the results were very similar and consistent with these. So for time, we haven't reported those here. So the implications of this is just to point out that heterogeneity in service provision between the different providers and sites can result in variable participation, and that's beyond that attributable to case mix, and I think that's an important lesson for future programmes like this. Extending out of hours provision may improve participation, and there may be measures needed to increase uptake in deprived areas and to improve retention among the groups that I've listed here. Just want to introduce you to our team. We're doing quite a large scale evaluation a number of years, and you can go to this website to find more about our programme. Thank you for listening. If you've got any comments, please log them and we'll read and respond.